Leaders in Washington took a look back at the pandemic tonight to discuss lessons learned and how to talk about how they might better combat COVID-19 or other widespread disease in the future.
Let's get to our Jennifer Dowling joining us live, and you've been digging deeper tonight, and also you've got a breakdown of what changes we might be seeing, Jennifer.
That's right. Leaders in Washington discussed ways that we could improve our response, and they say that having a global response with vaccines is important so that all countries are able to get access to them. Also, they say that we need to stop the flow of misinformation and shore up our supply chains.
I hope as we design the future response for the next pandemic that we would be able to do a better job.
Vaccine equity was top of mind during discussions on how to improve the pandemic response worldwide.
The fact that we are still in single digits in places in Africa, and we have oversupply in many countries in the Western world and the Northern Hemisphere, it's not right. And it's also now we are paying the price for that with the Omicron variant.
We should be doing everything we can to decentralize the manufacture of vaccines.
Representative Jayapal says the U.S. also needs to reinvest in public health systems, something done in places like Taiwan and South Korea nearly a decade ago after the SARS epidemic.
They increased the number of hospital beds, they increased their public health monitoring systems, and it better prepared them to handle the COVID-19 pandemic.
The Congresswoman says the presence of a universal health care system at times made the battle against COVID more effective in other countries, something the U.S. lacks.
In countries with universal health care, especially those with single-payer systems, people who got COVID didn't avoid testing or treatment out of fear of cost.
Representative Jayapal says there is a certainty that universal health care offers that is crucial to dealing with the pandemic.
People got kicked off of their healthcare insurance because they lost their jobs. So that direct connection between healthcare, somebody's healthcare, and somebody's job made it that much worse.
And Jayapal says that they're also looking at social media companies and their ability to control disinformation. She says that more regulation or a change in communication laws might be needed. Reporting live, Jennifer Dowling, KOIN 6 News.